ทุกท่านค่ะอยู่กับโค้ช
So good afternoon. We are back with me again in the afternoon section of the Site 2022. Now we will have the next session, Corporate Ventures in Deep Tech Startups. For nowadays, Deep Tech is something that is very attractive to the investors and to the major corporates. They are building their team in order to build and expand their business further. And there was a lot of response and agreement that Deep Tech is a hope of building the ecosystem of the future, and the major corporates in the country are very active. And let's hear how they play their roles or participate in these ecosystems and what are their expectations. So we are honored by the speaker from 3 organizations. The very first is the head of technology from AI and robotics, or ARV. Please welcome Mr. Pratinya Amaratananand. And next is the executive committee, senior executive VP, and also senior executive VP on biodiesel from the BBGI, Ms. Kitima Wongsan. Next is the Assistant Director on Innovations, BDMS, Dr. Siripat Paisuwat. So good afternoon and welcome our 3 speakers into the sessions. So am I loud and clear? So I'm with our 3 esteemed speakers on a very interesting topic about deep tech startups, and this is broadcasting live on Startup Thailand fan page. So I have a questions. It will be the same questions for the 3 of you, but we want to hear from the different point of views. Because when we talk about deep tech, there's a strong feedback on this particular issue, right? So I would like to hear from you, what are your point of views toward the deep tech in relation to your business, especially after COVID-19 pandemic? So let's start from BDMS. So actually, since the very start of the pandemic, the hospitals or the whole health infrastructures were severely impacted by the COVID. So as we all know, in the very beginning of the pandemic, the hospitals becomes empty because everyone is so afraid of catching the disease. But afterward, the crisis flipped. Now it became chaotic. There are so many patients coming in and out. However, as of now, it has been 2 or 3 years, and everyone's starting to be more health-minded. And when we're thinking about a new way of life, new lifestyle, due to the availability of the technologies, there is also a change in the expectation toward everything, also hospital included. So could you please share, may I share the slide? So if we look at the global level, international level, you will see that there are more and more people, but not enough resource, and there's more cost of everything, and everyone would be more attention to pay more attention to the health, and everyone want to take care of their health, but there's not enough resource, be it the people or the other resource. And then when you think about the Thailand as a whole, we have more populations, but there is a shift in the demographics, so there are more elderly populations. So it's very important. The healthcare become very important, and now more people can access the technology. And everyone wants something that is faster, and it has to happen right away. And when we talk about healthcare, then it shifts into the patient-centric mode. So what happened during this transition phase? The hospitals would need to change, they would need to adapt, and maybe it might be we maybe one of the last industry to transition because there's many standard rules and regulation applied. So could someone please bring up the slide for me? And let's go to page 3. Thank you. So nowadays, it has shifted over to the more customer-centric or patient-centric in our context, but this happens in every industry. So the service receiver, they want more convenience and better accessibility. So how should the hospital adapt? We need to apply the technology to make sure that accessibility happens and to reduce the density in certain places. So to get everyone to the physical hospitals, that might not be as convenient anymore. So we have to find a new way to allow the patient to access this healthcare service. So the hospitals, the service providers would have to partner with other industry, other business with different expertise to open up new channels of access for those who wish to receive the service. It does not have to be the patients. It can be someone who want to take a better care of their health. If you look at the slide, you can see that hospital is one of the caregivers, but there are also other industries who have to work together to have a complete and integrated healthcare system. We can see that we are now shifted to the patient-centric, and we want to allow a timely services. And also, we would need to develop the approach and make sure that the diagnosis and treatment is accurate, timely, and as safe as possible. So I think this is the direction, this is the way to go for the healthcare services and also for the medical service in the post-COVID era. So change will happen, definitely. There might be less people who physically go into the main hospitals. We would need to have a different, smaller nodes, more distributed, and apply the technology for a more precision care. And this would be the way for the post-COVID era to make sure that everything is that can take care of the patients comprehensively and also to take care of the health. Thank you very much. Now let's switch to Kun Kitima from BBGI. So after we have went through this COVID-19 pandemics, so what is going to be a direction of DeepTech from your point of view, BBGI, please? So could someone help me share the slide, please? So I would like to give you some background of the BBGI. The BBGI is, so our major business at the moment is the biofuel. So please forward to the next slide. Our major business is biofuel. Our capacities on we have for ethanol and biodiesel. For ethanol is 600,000 liters per day, and for biodiesel is 1 million liters per day. But however, moving forward in the futures, we will shift to the high-value bio-based products by applying the technology we call the synthetic biology. And that is our plan to move forward. So this might already answer a part of your questions, like why do we interest in the synthetic biologies? If you look on the right-hand side, you can see that what we are doing at the moment, the biofuel, is a mass product, and it has rather low gross margin. But our future direction on the high-value bio-based product has a better value and also gross margin. But in order to transition from biofuel to the high-value bio-based product, we would need the support of DeepTech. And that is our intention, that is our interest in order to transform our business from the biofuel to the high-value bio-based product. Thank you very much. Now let's move to ARV. Kun Patinya, please. So let me start by introduce my company. You might not be familiar with the name. We have only been founded for 3.5 years. Next slide, please. So ARV is an AI and robotics venture. The PTTEP has a complete hold over us. So we are not the main CVC. We are more of a DeepTech startup that spin off from PTTEP. So we start with having this small robotic club within the company. And during that particular point of time, there was the oil crisis. So the executive team were trying to think about way to adapt if there is no longer fuel available in the Gulf of Thailand. So we're trying to find a new S-curve for the whole company. So at the very beginning, there's only 10 of us, less than 10 of us, and we have been operated for about a year and a half, and COVID happened. So this might be the reasons why our growth rate is a little bit slower than predicted. But from then until now, 3.5 years, so we have already been 10 times bigger. Now we have about 400 employees in total. So ARV, we think of ourselves as a venture studio. So we have the deep tech technology development. So that's the technology development pillars. And we also have the ventures studio pillars, which would mean we would brought in the new startup, or we invest in the external startup, and we also work on the partnership ecosystem. During COVID, so during the pandemic, the ARV has some more time to rethink about ourselves. At that moment, we were still at a very baby steps. We do not have the commercialized product yet. So we focus on the internal R&D. And then last year, after the 2.5 years, we started to spin off our technology into 4 companies, the Bravula, Skylar, Varuna, and Kariva. Bravula is the spin-off business. So previously, we do support the oil and gas business for our mother companies. So we developed the deep sea robot that can inspect and also repair all the gas pipe. For the Skylar, that is a drone applied for the infrastructure inspections. Varuna is the agri-tech, and Kariva is directly resulted from COVID. During the COVID, our company was trying to find a way to support the country during the crisis, and our team. So we proposed that, well, we do have available robots. So we just put the UVC for sterilization on the autonomous robot, and it can be used as the sterilization robot in a variety of the buildings. And we also support the cold chain tracking for the country vaccine drive. And then that's the source of the Kariva. So what we see is that actually definitely COVID slowed down our business, but it also pointed us to the new direction and gave us a new point of view. Like everyone would realize, right, that the delivery business is such a boom during the COVID. And when we talk about the robotics, drones, or the remote working, this definitely going to happen. So it kind of allow us to refocus ourselves and to write a better roadmap. And for ARV, we also do R&D and investment in deep tech. So here we have a clearer roadmap of the investment plan. So Kun Patinya, as you are 100% in deep tech, right? So when you think about deep tech or the innovation or startup, which one that actually drive the business? So there's many of them that can actually drive the business, right? But seeing the roles of ARV in the deep tech ecosystems, especially after COVID, when the whole cities is open up again, what can you apply? So of course, when the situation is starting to get better in the past few months, people can commute, travel again. So ARV did kind of like a world tour actually. So I've flied to other countries and trying to connect with other partners and innovation centers around the world. So I was at the States and approached a variety of universities because admittedly, the DeepTech in the country, in Thailand, is still limited due to a variety of factors. So if we just keep on waiting for something that we develop by ourselves, then that would be too late. Because as we all know, that the life cycle of deep tech development is rather long, and it might not be able to answer the needs of the corporates who want to get a high return in a short time. So we're trying to identify the deep techs from other sources. So we visit MIT, Harvard, Stanford, and so on. And what we have found is that in the States and also Korean, there are deep techs everywhere, ready to be harvested and commercialized. So we started to develop a partnership with a variety of university and research labs. And I think that when we look at ARV, what we have been trying to do is to create the ecosystems and connectivity between ecosystem in the country and outside of the countries. So we also are a venture studio. So we want the Thai startup with idea to come to us, and we can connect them with the global technology. And if they're working with us, we can also provide support on the back offices, on technologies, and this would allow the researchers to completely focus on their research without thinking about the cash flow or about the staff. Thank you very much.
Let's listen to Kun Kittima from BBGI. What's the role increase to drive your business? Kun Kittima, please. Yeah, can I have a slide, please? May I explain about the deep tech that BBGI is interested? Next slide, please. What we're interested is the synthetic biotechnology. Simply explaining with like beer fermentation. This is what we're doing, that we use the yeast. Is this the natural organism? And we have allowed it to transform under the fermentation process, and the synthetic biology that we do, that's differently, that's the microorganism that we change yeast into sugar is processed with the transform it in terms of to get its fermentation, purification, product modification. And with this product, with the process, we can do it in many modes: food ingredient, food supplementary, or in the COVID-19, we also produce vaccine using this technology. So next slide, please. So this is why we see why SynBio as new game changer. It's gonna be a new innovation asset. It can produce in any kinds of ingredient. And another thing is it use less time comparing to the usual process. For example, if we produce dairy products, usually we have to start with cattle, we have to start with, the dairy or the traditional dairy product. But with this technology, we can make it done in few days, so much faster. Another thing is about environment, that using this symbiotic, we use less resources and less areas of cultivation. So we don't have to worry much on the lands and use less time, use less resources, including the GHG emission. So it also help the environment and produce any kinds of goods for the betterment. So the question is what we are doing now. Next slide, please. What we are doing now is that this is some examples that we have invested in many startups. In the last, this is the Minus Bio from America, and they expertise in synthetic bio, and the founder was a professor and researcher from MIT. So we have invested in this field, and we have found JV company together with them, win with them. So this is how we launched our product to the market in Southeast Asia and Japan and Korea. So this is our first phase, and we have planned to set up the manufacturing, the factory of the Minus Bio in the next few years. And with this symbiotic new technology. Another thing is that we invested in bio company. This is a spin-off from Faculty of Science, Chulalongkorn University. And bio is specialized in synthetic technology and invested invested already and get patent of this bio for marketing. So one product that's interesting on this is the enzyme that we use to purify the chemical pesticide. It helps to detoxicate of the residue. So this is how we improve the startup company. They can upscaling to commercial level. And this is what we are doing. And next slide, please. However, what we foresee in the future, we cannot work alone with the SynBio technology in Thailand. So we got cooperation with another 16 units, both public and private sectors, in set up SynBio consortium. Next slide, please. This is the roadmap of SynBio consortium set up, been developed as the SynBio ecosystem development roadmap. In the future, we would like ASEAN to be SynBio, to expect Thailand to be able to develop new S-curve industry from using this symbiotic technology. And our procedure have passed 3 phases. In the first few years, we're going to focus on capacity building and to create cooperative platform with other countries. And also we get examples of SynBio using commercialize it. And then in the middle phase, we looking for scaling up with the researcher to develop as the pilot plan and commercialize it, upscaling. And the role of researcher, as said, we have planned to set up the factory to produce these products using this symbiotic technology. So we're going to involve in this part for the long-term plan. We look at how to increase entrepreneur using SynBio technology users. And this is going to create more opportunity. Like in 2030, this is what we expected that we run with the consortium. Thank you very much, BBGEI. Now let's take a look from Kun Siripat, BDMS, how DeepTech can help enhance your business. Yes, may I have slide 6, page 6, please? For the DeepTech of BDMS, it may be different from BBGI and ARV because we are not the producer of DeepTech, but we see DeepTech that can be developed our business through the many kinds of startup. In our plan, we've seen after COVID-19, we thought DeepTech could enhance our service level, not only in BDMS but also in the general area healthcare of system of Thailand. As you see in this diagram, DeepTech can use like AI or machine learning to enhance the treatment to be more precisely. And or example, use the teleconsultation for seamless treatment anywhere, anytime to reduce the congestion at hospitals and to reduce workload of the medical professionals. And last but not least, to help the patients, we can help them in terms of prevention, not only the treatment. So we use the health content and we get the new credit and medical checkup, a health checkup in depth to get the actual health checkup result. Or we can promote prevention better than cure. All of this can use deep tech, machine learning, AI, or blockchain. So can I have next slide, please? As said, as we are not deep tech producer, so to develop technology in healthcare industry, there's standards in treatment, there's risk in treatment patients. So we cooperate with startup, and we found that startup, we used to talk to foreign startup and Thai startup, and we found Thai startup has no less potential than other country. We have similar capacity, but the limitation of Thai startup, probably lack of opportunity or the areas to develop technology and to make it to become deep tech. So in terms of BDMS, we propose ourselves. We open the areas at our hospitals of BDMS nationwide, more than 40 hospitals, 40, almost 50 hospitals that we allow. We use our expertise, professionals, to help Thai startup to develop deep tech. That we believe that deep tech, after it's been developed, it's gonna uplift the BDMS service and also to develop medical standard of Thailand to cope with chronic diseases and aging society. From what you see in this diagram, that deep tech startup has lots of potential but still lack of opportunity. And so we run the program having Thai startup that working with us, get training, have workshop, and to share, we share our knowledge and experience with them and mean two ways so that they can have better understanding in the healthcare environment, and also the health checkup, and we use deep tech at hospitals. Then as said, we open the area for Thai startup for POC, have the hospital as the sandbox that they can develop the technology for that has potential to be deep tech or any potential technology. Allow Thai startup to develop themselves and to overcome obstacles in terms of time. Like Kun Patinya said, when to develop deep tech, it requires long process, especially for healthcare, it's even longer. So that because there's a certain standards, that lots of risk that we have to consider. So the cycle of the research probably get even longer. So this is what we foreseen, and BDMS is going to allow our area for this development. And last but not least, because we have, when we look at startup, we expect that startup that will use this technology, any kind of technology at hospital, must be POC and tested and to be for in terms of accuracy, reliability, to make sure that it can be scaled up to any branches of our hospital. So this is we also consider in terms of investment. In this, we cannot do it alone, and we need alliance like everywhere notified us. Not only BBGI and AVI, we need more cooperation, and also the private public sector or education institution like Chulalongkorn University is also help us in terms of economic, and Thai Health Tech Startup Association also help us a lot in terms of recruiting startup to cooperate even furthermore, so that we can finally develop DeepTech for the youth, for the healthcare of Thailand. Like Singapore, we have DeepTech startup. One day, Thai startup gonna be developed to that level as well. So as said, we have the different longer life cycle, and we expect BDMS one day could be part of the DeepTech technology and environment and contribute to the country. So it sounds like BDMS ready to support, right? Because startup DeepTech is still less, right? Kun Patinya, what is the ARV can play roles in startup technology? Yes, as I said, we trying to connect Thailand to the world. Like as said, we have planned to set up the innovation hub in many places to access to the research and to the access to the talent. At this point, we have a team in America, and in many institutions that many Thai students, undergrad or grad students, they want to return to Thailand in DeepTech industry. But in the past, they cannot really see what opportunity they could have when they return to Thailand. So that's why we're trying to have them to get the internship. Also, as ARV is under the umbrella of PTT, we have a program of the special corridor of EEC. So we are now working on smart city like a sandbox. And we get more cooperation. And we're trying to develop the UTM system management. And this is what the management of the drone of aviation. And we're using smart city concept as the sandbox to reduce regulations, because DeepTech is the new thing. So to test DeepTech in the country sometimes it's quite difficult because of limitation. As Kun Siripat mentioned, in terms of hospital, BDMS is ready to be sandbox. In terms of drone ARV, we are also ready for robotic and sandbox too. BBGI, what role you can support Thai startup? As I mentioned earlier, that we are trying to support Thai startup, and this is one example that we're using research finding on shelf to get executed, to commercialize it and do market, launch it into the market. As I said earlier, another plan we have is that we will develop infrastructure for synthetic biology. We're gonna have a factory at commercial level. Like nowadays, EECI have stepped further. Now we probably at a lab scale at 300, 500 liters, but finally we're gonna do it upscaling up to 10,000 liters. that's commercial level, and or even 100,000 liters. So this is our long-term plan to develop infrastructure of Thailand to be more potential in symbiotic technology. So last but not least, can I listen from Kun Kitima BBGI how to drive DeepTech completely in Thailand and also to enhance DeepTech industry in Thailand for sustainability. What's your view on this? What contribution we need? What support do you need to drive DeepTech to the ultimate level? We think for symbiotic technology is about personal development, because when we work with partners, they will ask how many people in Thailand that they know biotechnology. So number one priority is to develop infrastructure. That is something that we can contribute. Number three, that's also important, is that to develop regulations to be more supportive to the upcoming deep technology, because this is very critical, right? Yeah. Thank you very much. Dr. Siripat from BMS, please. Yeah, similarly to Kun Kittima, this is for the technology user and who work with startup. Can I have slide 10, please? For BDMS, if we want the country to be developed and change it, we need to create more cooperation. Right. This is the BDMS innovation policy framework. Not the startup is in the middle. BDMS is part of it. And we believe if we want to develop deep tech in terms of healthcare, the life cycle of deep tech is pretty long. So those who can help is that the private sector, the investment in research, basic research, for example, and this is the big lump of money. Not only the regulation, but also the regulation to use technology, to have telecommunication health safe and accessible widely. How to use technology in healthcare to uplift the medical standard. It should be up to date. It should be and also educational institution, from shelf to shopping mall or to shop, from shelf to shop. We need a lot of support for execution. Altogether, we can drive this only if we have startup in the middle and who's developed technology for execution, commercialize it. Like in private sector, like BDMS, we support the area of sandbox and allow the scale up. But anyway, when private sector can create appropriate ecosystem for deep tech, everything's going to be complete in this cycle and drive deep tech environment in Thailand to be growing. So Kun Patinya, please add more. What we still lacking in terms of personnel and technology? Actually, we have lots of innovation, like BDMS is already have been doing quite a while. Kun Patinya, for ARV, altogether, how we drive ecosystem for deep tech for sustainability. Yeah, similar to other two speakers, that to develop deep tech life cycle, as it's quite long, it requires all sectors to get together private sectors, public and private sectors, every sectors. One limitation that we see is important is that the regulations. I think I would like the government to adjust regulations to be more supportive for deep tech development. At the same time, private sector, venture CBC get more interested in deep tech because deep tech take long time to develop. So it's easy to get ignored or abandoned. So we need public sector to boost up this and to complete our ecosystem. Yes, thank you. So we have many contributors ready to drive the deep tech environment, and these three organizations all agree with this. So in deep tech, it still require further development. As the back office is quite ready, but we need more support for the front office because it's high demand but still less supply, especially agriculture and healthcare. So thank you very much to three speakers, Dr. Siripat BDMS, Kun Kittima from BBGI, and Kun Supinya from Avia. Take a short break, please. See you in a bit.